Welcome to your most favorite channel, Heartbeat. My name is Dr. Amrit Kejriwal. As a student, I say most of the teaching will be digitalized. Hard copies of books will become obsolete. They will be replaced by soft copies. Lectures and lecture halls will cease to exist. They will be substituted by videos and online classes. Practical classes will remain in medical sciences. We have to prepare ourselves for a revolution in learning and teaching methods in all disciplines. In continuation with our electrocardiography series, today we will discuss rhythm. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Rhythm. To see if the heartbeat is beating regularly or irregularly, and this may cause predisposition to major arrhythmias and complications. So, the following beats originate in the SA node: the normal sinus rhythm, sinus bradycardia, sinus tachycardia, and sinus arrhythmia. The normal heartbeat has a rate of 60 to 100 beats per minute, and it forms the basis of all other rhythms on deviation from the sinus rhythm. So this is the ECG of a normal sinus rhythm. Heart rate is 60 to 100 beats per minute. Rhythm is regular. You can see the RR interval over here. It's quite the same. P wave is identical prior to each QRS complex. You can appreciate over here. And PR interval varies from 0.12 second to 0.2 second, and QRS duration is less than 0.12 second. So it's between 3 to 5 squares over here, and again the QRS complex is less than 3 small squares. Sinus bradycardia. The heart rate is less than 60. So you can see greater than 5 large squares. So the heart rate is less than 60. Rhythm is regular. The gap between these two is, and say our QRS complexes, is almost the same. P wave is identical prior to each QRS complex. PR interval is 0.12 to 0.2 second, and QRS duration is less than 0.2 second. Sinus tachycardia. Heart rate is greater than 100 per minute. So the gap between two QRS complexes is less than 3 squares. Rhythm is regular. P wave is identical prior to each QRS complex. You can see over here. And PR interval is from 0.1 to 0.2 second, and QRS duration is less than 0.2 second. It can be appreciated. Sinus arrhythmia. Heart rate is a bit variable. Rhythm is irregular. P wave is identical prior to each QRS complex, and PR interval is 0.1 to 0.2 second, and QRS duration is less than 0.12. So over here you can see the QRS complex gaps. RR interval is increased over here, here, and here, but more than these two places. So you can see over 4 small squares. Here it is approximately 5 squares. This is sinus arrhythmia. Atrial arrhythmias originate in the atria, not the AV node, SA node, sorry, and it can be atrial fibrillation, atrial flutter, wandering pacemaker, multifocal atrial tachycardia, supraventricular tachycardia, premature atrial complexes, or Wolff-Parkinson-White syndrome. So this is premature atrial complexes. The heart rate is a bit variable. Rhythm is irregular, and P wave is identical to each QRS complex. Occasionally it may be premature or absent or hidden. So you can see over here this QRS complex and this QRS complex, they have come a bit earlier. PR interval is basically 0.1 to 0.2 second, and QRS duration is less than 0.12. So you can see these QRS complexes. Atrial fibrillation. Heart rate is a bit variable. You can see the gap between the QRS complexes is variable. Rhythm is irregular. P wave is wavy. PR interval cannot be measured, and QRS duration is less than 0.12 second. Atrial flutter. heart rate, atrial rate is varies from 250 to 400 per minute, and ventricular heart rate is variable. You can see over here, gap between the QRS complexes. Rhythm is irregular. P wave gives a sawtooth appearance. PR interval cannot be measured. QRS duration is less than 0.12 seconds. Wandering pacemaker. Heart rate is variable. Rhythm is irregular. P wave has different morphologies, and PR interval is variable, and QRS complex is less than 0.12 seconds. So on this we can see that the P wave has a different morphology. This is variable PR interval. Some is short, some is very long. Okay, and the P waves have different morphologies, but the QRS complex is less than 0.12 second. Here are the various nodal rhythms. They originate in the AV node. Junctional rhythm is 40 to 60 per minute. Accelerated junctional rhythm is rate 60 to 100 per minute. Junctional tachycardia rate is over 100 per minute, and you also get the premature junctional complexes. Now just let us see one or two of these. And it is inherent rate of 40 to 60 per minute. So this is junctional rhythm. You can see that the P waves are absent in this particular rhythm, and the heart rate is less than 60 per minute. Rhythm is regular. P wave is absent. Occasionally it may be inverted. PR interval cannot be measured, and QRS complex duration is less than 0.12 second. Ventricular rhythms originate in the ventricles or Purkinje fibers. There can be ventricular escape rhythm, idioventricular rate of less 20 to 40, accelerated idioventricular rate of 40 to 100, and ventricular tachycardia rate over 100. Again, ventricular tachycardia monomorphic, regular, similar shaped wide QRS complex, or it can be polymorphic, Trossard's D point is life threatening if sustained for more than a few seconds due to poor cardiac output from the tachycardia. You also get ventricular fibrillation, in which the waves are fine and coarse, and you get premature ventricular complexes. So look at these ventricular premature complexes. The heart rate is variable, rhythm is irregular, P wave is absent in the premature beats. You can see over here there is no P wave. PR interval is not applicable, and QRS duration is normally 0.12 second, but the QRS duration of the premature beats is bizarre. So in this we are getting two ventricular premature beats coming together, a couplet, and three ventricular beats coming together, triplets. And this is how the polymorphic QRS complex will look. You've got different QRS complex over here and a different QRS complex over here. This is ventricular tachycardia. Heart rate is 100 to 250 per minute. Rhythm is irregular. P wave may be seen corresponding to QRS or usually absent. PR interval cannot be measured, and QRS duration is greater than 3 small squares, that is greater than 0.12 second. Ventricular fibrillation. Heart rate cannot be measured. Rhythm is chaotic. P wave is absent. PR interval cannot be measured, and QRS wave is not seen. First degree heart block. So in this, the heart rate is normal, regular rhythm, P wave is identical and present before each QRS complex. PR interval is greater than 0.2 second. You can see over here, greater than 0.4 second approximately here, but QRS duration is less than 0.2. Second degree AV heart block, MOBITIZ type 1 block, Wenckebach's phenomenon. In this, there is progressive prolongation of the PR interval. So the heart rate is normal to slow, rhythm is irregular, P wave present but some not followed by QRS complex. So you can see here is the PR interval, it gets prolonged, and finally this is not followed by a QRS complex. Again, PR interval is here, it gets prolonged, and this one is not followed by a QRS complex. You can see the difference. PR interval progressively longer, and the QRS duration is less than 0.12 second. Second degree MOBITIZ block. Heart rate is usually slow, rhythm is regular or irregular, two or more P waves before each QRS complex. So you've got two P waves, one QRS complex, two P waves, one QRS complex, two P waves, one QRS complex. This is a 2:1 block. If there are three P waves before each QRS complex, it is called 3:1 block. And PR interval in the present part over here 0.12 seconds, 0.2, 0.2, and QRS duration is less than 0.12. Now the top ECG is same as the previous ECG, classical 2:1 block. This is an intermittent 2:1 block, AV block. So over here you can see two P waves, one QRS complex. Again two P waves, one QRS complex, but this part is normal. So this is intermittent 2:1 block. MOBITIZ type 3:2 block. So you're getting 3 P waves, 1, 2, 3 and 2 QRS complex. So this is called 3:2 block. This is ventricular tachycardia. Heart rate is 100 to 250 per minute. Rhythm is irregular. P wave may be seen corresponding to QRS or usually absent. PR interval cannot be measured and QRS duration is greater than 3 small squares, that is greater than 0.12 second.